Hi, I'm Suresh Kumar. I'm the Pharmacy and Purchasing Manager at the Hospital Pantai Ipoh. Today I'm going to talk to you about the proper storage and identification of medication. And I'm also going to talk a little bit on the expiry date of how important it is to actually to ensure that all medication that you're taking are actually within the expiry date. Now, proper storage, a lot of people actually like to store medication in two most common places. And one is actually in the bathroom and one is actually in the kitchen. Now, sad to say, both these places are actually inappropriate to actually keep medication. You keep your medication in a cabinet in your bathroom. Now, bathroom is actually a very humid place, all right, and there is actually a fluctuation of temperature in the bathroom. So therefore, keeping your medication in a cabinet in a bathroom is actually not a proper place. And another most common place that actually they keep is actually in the kitchen, And kitchen is actually where the lots of cooking and flames and all that, and it actually get a little bit, temperature actually rises up. Now, this is also not a very suitable place to actually keep your medication. The correct place, what we would recommend, would be in a proper medicine cabinet kept in your bedroom, all right? And if you have children and pets, you have to ensure that they have got no access to the medication, all right? It should be kept on a higher place and should be locked at all times. Now, to ensure that your medication is actually kept in a proper storage is because heat as well as humidity destroys medication. Keeping medication in your car and locking it up and going somewhere else and coming back again would actually able to disintegrate some of the chemical properties of the medication. So therefore, it's important that medication are actually kept in a proper place and ensure that medication are not, the children and pets are unable to reach the medication. Now, it's also important to actually identify the medication. Now, it's very important. I've seen that what people do is they actually take out from the foil and put it in a bottle and do not label the bottles, all right? At the end of the day, you do not know which medication is in which bottle, all right? Now, that actually causes a serious problem when you actually double dose or you take the wrong medication, all right? You may require to take medicine A and medicine B at a different interval times, but because you mix them up and put them all in one bottle, there'll be time to come where you do not know which is which and you're able to actually double dose or underdose yourself. So it's important that if you are keeping a medication, if you're taking out from the foil, it's good to keep one medication in its foil in the bottle as to identify that this is the medication that you have actually kept in a bottle. Or you could actually jot it down. You actually take photographs of the medication and its foil and keep it actually in a small mini album, which you can use to refer if you're in doubt, if you need to identify your medication. These are the things you need to ensure that, especially for elderly patients, they actually get mixed up what sort of medication. It is actually not recommended to put all medication in one bag and expect to actually carry around this bag. Sooner or later, at one point of time, especially the geriatric, the elderly patients, would actually get confused which medication is actually for which indication. All right, so that will be an important aspect to ensure that your patient or you get the correct medication at all times.